center paper, A-scan parameters and complications during cataract surgery in eyes with pseudoexfoliation syndrome.
Good morning to all. I'm presenting a study on A-scan parameters and intraoperative complications in cataract surgery in eyes with pseudoexfoliation syndrome. Pseudoexfoliation is a genetically determined, generalized disorder of the elastic fiber system with excessive production of and accumulation of elastotic material in intra and extraocular tissues with the deposition of white dandruff-like fluffy material on the corneal endothelium, anterior lens capsule, lens zonules, iris, and trabecular meshwork. The complications in cataract surgery in eyes with pseudoexfoliation syndrome include poor dilatation of pupil, zonular dehiscence, posterior capsule rupture, lens luxation, vitreous loss, decentration or dislocation of the IOL. Since only minority of the patients with pseudoexfoliation get these complications during the surgery, it is important to find out those who tend to have complications beforehand. So the aim of our study was to study the association of preoperative optical A-scan parameters with intraoperative complications during phacoemulsification in eyes with pseudoexfoliation syndrome. Ours was a retrospective study of 200 eyes of 184 patients with pseudoexfoliation who underwent cataract surgery by phacoemulsification within a period of 2 years. We excluded those with a history of previous intraocular surgeries, trauma, and where there is an obvious dislocation or subluxation of the lens preoperatively, cataract surgery by small incision, cataract surgery combined with other surgical procedures. Preoperative evaluation were done, including best corrected visual acuity, presence of pseudoexfoliation material deposition, presence of phacodonosis, pupil dilatation. A-scan biometry was done with IOL Master 700. Phacoemulsification with IOL implantation was done by 5 experienced cataract surgeons, and pupil expanding devices or capsule supporting devices or iris glow IOL and anterior vitrectomy was done when needed, and statistical analysis was done. These are the results. 200 eyes of 184 patients with pseudoexfoliation were analyzed, and the mean age was 71.34 plus or minus 6.2, ranging from 50 to 90 years, and the majority were males. The most commonly associated systemic comorbidities in our study were diabetes and hypertension. The mean best corrected visual acuity preoperatively was 0.79 logmar, which improved to 0.1 logmar postoperatively. Majority had nuclear sclerosis grade 2 or 3. Small pupil were found in 32 eyes, which were managed with iris hooks in 12 eyes, viscoelastics in 19 eyes, and Coughlin in 1 eye. Intraoperative complications were noted in 34 eyes, among which zonular dehiscence or weak bag were present in 31 eyes, which was managed with a CTR in 29 eyes and iris glow IOL in 2 eyes. PC rent was observed in 3 eyes. Vitreous prolapse was noted in 5 eyes, in which anterior vitrectomy was done. On comparing the preoperative A-scan parameters in the group of patients with or without intraoperative complications, the anterior chamber depth was significantly lower in patients with complications. The lens thickness was significantly higher in patients with complications. The axial length by AC ratio was significantly higher in patients with complications. And axial length alone did not have any significant association with any of the groups. The chance of intraoperative complications increases as the AC depth decreases, as shown in the graph below. The risk of intraoperative complications were 36.68% in eyes with anterior chamber depth less than 2.5 millimeter, compared to 14.9% in eyes with AC depth more than or equal to 2.5 millimeter. And the pupil dilatation did not have any significant association with complications. Preoperatively, mild phacodonosis was noted only in 3 eyes, and the actual intraoperative zonular dehiscence was present in 31 eyes. So this shows the importance of our study. Coming to the discussion, the production of pseudoexfoliation material by the non-pigmented ciliary epithelium and the preocular lens epithelium causes typical alterations in the zonules at their origin and attachment. And this, along with the proteolytic activity of the lysosomal enzymes in the pseudoexfoliation deposits, causes zonular disintegration. This causes anterior movement of the lens and increased curvature of the lens, which in turn causes the shallowing of the AC and increased lens thickness. The ratio between axial length and the anterior chamber depth, this was not used in studies before to our knowledge, And this shows a relative anterior segment crowding. And this is due to the anterior movement of the lens iris diaphragm due to zonular weakness. And this was found significantly higher in eyes with a group of complications. There were only two studies previously regarding the association of AC depth and the chance of intraoperative complications. And compared to their studies, our study had a higher sample size. Mean age was similar. Sex predilection was male. And the A scan used was optical A scan in our study. Other two studies used ultrasound A scan. Cataract surgery was by phacoemulsification in ours and the Kushal et al. Study. But Praveen V et al. Used small incision cataract surgery patients. Zonular dehiscence percentage was slightly higher in our population, our group. PC rent was similar. In all the three studies, the AC depth was significantly lower in patients with complications. But in our study, we also got the result that increased lens thickness and increased axial length by AC ratio were significantly associated with intraoperative complications. So our study is the first study in South Indian population analyzing the association of optical eye scan parameters and intraoperative complications during phacoemulsification in patients with pseudoexfoliation. And the limitations of our study being retrospective nature, and we included the weak backs along with the zonular dehiscence. To conclude, preoperative shallow anterior chamber and increased lens thickness are the indications of zonular instability in pseudoexfoliation syndrome. Anterior chamber depth of less than 2.5 millimeter is a high risk factor for complications during phacoemulsification. And cataract surgeons should take caution while operating such patients, anticipating possible intraoperative complications. These are our references. Thank you.
Thanks for that nice presentation. Can you just get back to the A-scan parameters slide? There's a table there where you have compared with.
Yes, yes.
Not this one, the other one. With axial length, you
Yeah,
have,
yeah, yeah.
right? Yeah. This is not axial length is it significant or not?
Axial length is not significant.
Not significant,
Alone is
right?
not significant.
No. AC depth.
AC
and,
depth and lens thickness are significant, and the ratio is significant.
the
Movement,
lens,
anti movement
iris
of the
length.
lens.
Axial length by AC ratio, you could do a lens fold study. What can actually happen is the anterior lens fold.
Yes.
ASOCT, you could have done this. Nevertheless, it's okay. You have done whatever is there, right?
Then you have to buy another machine, and
Yeah.
that's difficult. But what it actually reflects is your anterior lens fold.
Yes.
But another thing is the pupil size didn't really matter, is it?
In our study, we didn't get a
single
significant
surgeon?
correlation with the small pupil size and intraoperative complications. That in moderate dilatation and good dilatation as well, there were intraoperative complications.
Oh, you used pupil expanders.
Yeah, that
in all of
maybe
these
because
cases, right?
they used pupil expanders.
Go to the reference. What is the present study you should sort of compare it with now? Because we have the.
When was it published last?
These
Good
two were the.
references. Next one. Number 9, no? That's the sort of, what is the present study which you should, which is the longest running study data is going to come out now?
Aravind pseudoexfoliation study.
Effect study. Yeah. So it was present in the RO last year, no, a few years back. Academy presented, yeah. So that's a 10-year study. It's going to come out now. But just to give you an idea, the 6-year results were out some years back. And the rate of complications are, little less. Of course, that's a multicentric study, and because pseudoexfoliation, then the most experienced surgeons will be operating in situations like that. That's a different bias, totally. Leave that. But head to head, you have to sort of know that also. It's a largest running study. And go back to the complications slide. because in their study also the pupil diameter was 7 millimeters. Nothing, they didn't have very good pupil dilatation. So so we have to see how we can even reduce this further.
Yes.
Once pseudo exposition, we have to anticipate all these things.
Yes.
Because head-to-head comparison, that study at 6 years, they had 50% less complications. So that will sort of become the benchmark. We don't know. Very difficult to manage pseudo exposition. Nice study.
Thank you.
Why were you not able to do it prospectively? Because definitely you would have missed follow-ups. You have missed 200 eyes, of 183 patients. How many patients?
184 patients.
184 patients. So definitely you would have, there's some loss to follow-up, some patients not able to come out. So better to do prospectively rather than retrospective.
That's what they did only. That notes will be.
Yeah. Should do it prospective. Thank you.
Thank you.